NHS accepted money from milk formula industry. NHS bodies are risking babies' health by accepting money from companies in breach of World Health Organization rules, an investigation has found. Nearly a third of local commissioners responsible for allocating NHS cash have breached guidelines, such as by accepting payments or sponsorship over the last 5 years, the survey revealed. The International Code of Practice is intended to protect breastfeeding and regulate the often aggressive marketing of breast milk substitutes. Experts last night said that doctors in NHS Clinical Commissioning Group CCG areas which had flouted the rules may be at higher risk of inappropriately recommending branded milk formula. Many will have attended training events sponsored by formula companies and awash with commercial literature, said Dr. Laura De Rui, a consultant neonatologist at St George's Hospital, London. All those training days are not necessarily providing those healthcare professionals with unbiased information, she said. The other really important point is that if there is advertising of those brands to those healthcare professionals, pediatricians, they are more likely to prescribe those brands to you. And so even the advertising that is directed at a scientific audience, a pediatrician audience, can be misleading. Conducted by Channel 4's dispatches, the investigation revealed that 59 of England's 195 CCGs had recorded a breach of the Code of Practice since 2014. The programme also says it has obtained leaked documents from the marketing agency of Danone, which dominates the UK formula industry with its brands Cowgate and Aptamil, revealing a £4 return on investment for every £1 spent on marketing. Professor Anthony Costello, a former director at WHO, said if you're a company and you want to promote your products, you want to reach the people who are most influential. So that will be pediatricians, it will be dietitians, it will be nurses, midwives, health visitors. Companies are now right in the NHS and that is extremely concerning. Meanwhile, Sue Ashmore, UNICEF UK's baby-friendly initiative director, called for stricter legislation, adding we need to make sure babies and parents are protected from commercial interests and misleading marketing practices. The Act has one of the lowest rates of breastfeeding in the world, with just 34% of babies receiving breast milk at 6 months of age, compared to 62% in Sweden. The latest investigation follows a report in the British Medical Journal, published in December, which suggested that the over 10 years is partly due to links between the formula industry and doctors. The report found that the annual NHS bill for treating such allergies had increased from £81 million to more than £60 million between 2006 and 2016. A spokesman for the Department of Health and Social Care said parents have a right to accurate, unbiased advice from healthcare professionals and it is completely unacceptable for healthcare providers or workers to receive financial incentives of any kind to endorse particular brands. Telegraph Media Group Limited 2019. We rely on advertising to help fund our award-winning journalism. We urge you to turn off your ad blocker for the Telegraph website so that you can continue to access our quality content in the future. Thank you for your support.
Raindrop, drop top, smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.